Scott County, providing safe, healthy, and livable communities.
We are going to receive information on Scott County delivers emergency preparedness and surprise snowfalls. I had that part on there.
Good morning, Good morning, Mr. Chairman, Commissioners. We are here to talk about emergency preparedness and emergency management this morning. This group was last here in 2018, and at that time, there was quite a lot of information presented around the county's capacities. And there were also some very good questions asked from the county commissioners about prioritizing and progress and kind of where to get our most bang for our buck. And so we're going to talk about all those things and try to circle back to those questions that you had at that time. I did want to point out a couple of other things. There's not good community indices for emergency management. It's a scale of capacities, and Scott and many of the other people here are going to talk about that this morning. But one solid piece of data we do have comes from our resident survey, and in 2019, 71% of residents rated our disaster preparedness as good or excellent, and that is the single highest rating that has ever occurred since the question was added in 2011. And so there's some reflection in our community that there's progress and that is viewed positively. The last thing I just wanted to say is that emergency management is factored significantly in our new strategic plan, both in the values that we're going to prepare and respond to emergencies, and also there's a couple of specific tactics around training, building resiliency among our residents and our communities, and I think our panel is going to speak to some of those pieces of the work that's coming in the future as well. Morning. We do have a couple of folks that are going to come in as a result of the tricky roads this morning, but I'm going to ask folks to introduce themselves, and then we'll get started right away with questions.
Brad Davis.
Suzanne Artson.
Jennifer Schultz.
Kara Madsen.
Kate Sodlogic. Lisa Brodsky.
Scott Haas.
Thank you. All right. Suzanne, do you want to start?
Sure.
Thank you.
So good morning.
Good morning.
Thanks for putting all the information together. I'm going to refer us to page 5. As we look at the grid, I'm curious, what would you identify sort of top 1 or 2 priorities? Where might we have sort of the biggest impact in terms of just trying to continue to move forward in this area?
Thank you for the question. I think right now, as we look at all of the 32 core capability areas and where we're strong and where we're lacking, the grid, just to explain the grid for those of you who are putting a fresh set of eyes on it, the green areas are areas we're meeting capacity. We, through our self-rating, think we're doing okay on. And dark red areas are areas that we're really doing poorly on. And the bolded areas are areas where we've been making an improvement over the last year and a half. As we look at where our biggest bang for the buck comes in, we really focus on, at least in my opinion, we focus on how we make our own staff prepared and get them up to the base standard. I think that's a fundamental step we need to take, and we're taking action to get there. But if we don't have our staff up to a basic standard, none of this means anything. If we can't perform when some kind of an emergency or disaster occurs, whether that be a tornado, a flood, a pandemic, a cyber incident, if we can't perform, none of this matters. We're going to fail across the board. So my opinion is the priority of all of the areas is to really focus on getting our training level up just to a basic standard so we can actually start addressing some of these core capability gaps.
Scott, along with that, on page 23, I think that kind of shows where we're at from a training perspective with NIMS compliance, if I'm reading that correctly. And so we've kind of stayed even, gone up maybe slightly with our training. What would be the ideal, or where would you like to see that for staff being trained, and what are you trying to get to, and how do you see, so a few questions. How do you see that happening, and kind of what's your goal for a timeline for us to be where we would need to be from a training perspective for staff?
Sure. So the excuse me, the national standard is any employee of government who could be involved in a response should have at least the IS 100, 200, and 700 courses and certifications at that level. If you look at the chart, that's measuring what we currently have records for. So over the course of the last year, through a number of discussions with county administration, with employee relations, we've established a few steps that we're taking. The first being delivering that training to the senior leadership team. That was completed at the end of last year. I believe December was the completion of the last of those classes. So we got our group of senior leaders up to the standard where they've had the opportunity to go to the training. The next steps moving forward are to look at how we then bring the bottom up as well. We've had discussions with the employee relations director over how we would implement this moving forward. And our plan is that the IS 100 and 700 courses, which are actually the entry-level courses compared to the 200 course, which is more advanced. I don't know why FEMA does that, but it's FEMA. Those classes are going to be taught every month in a classroom setting. So any new employee coming in is going to have the ability and the expectation to go through the IS 100 and 700 courses taught by our staff in a classroom setting with the expectation that they then get the IS 200 course done using the online independent study action. So this is an area I would expect over the next 2 years we're going to see a very dramatic shift in, and I would expect us to be very close to 700 employees in the course of 2 years that are trained to that minimum standard.
Scott, for existing staff, like you spoke to the new staff coming in, but what's your request or what's your recommendation for supervisors with regard to existing staff?
Lori Huss is actually going to be sending an email out shortly. When exactly that is, but detailing a plan to bring all staff up to that standard and what the plan is. So existing staff will have the ability to go to those in-classroom classes if they wish to do so. Otherwise, they'll be able to take the online courses and get compliant that way as well. But we're putting, I believe, we're putting end of 2021 as an expectation date for that.
Thank you.
I had a couple of questions on page 17 on the volunteers. It looks like in 2019 there was a pretty significant spike in the number of volunteers. I'm just wondering what you're attributing that success to.
So I can address that. The volunteers, recently we purchased a new program here in Scott County for our volunteers. So we have been working to update all our records to make sure that the volunteers that we currently have in the system are still available. I have been tasked with bringing on more volunteers for some upcoming drills that we have going this year and the following year. So I have been really reaching out to the community and then, in fact, talking to the volunteers we currently have. They may be a library volunteer, but asking them if they'd be interested in volunteering for emergency management cases. So we're trying to develop a little bit stronger team that we can really reach out to for emergency management purposes, although we would be able to reach out to our entire volunteer corps.
Mm-hmm. And the chart shows a target for anthrax, and I'm wondering, is there targets for other types of public health emergencies other than anthrax?
So I see Alexa coming right now. But just on the previous question, in 2018, we actually changed our volunteer process, and that actually made quite a difference. Previously, we had a separate volunteer database for our Medical Reserve Corps and the county's system. So our volunteers actually had to apply for the Medical Reserve Corps and the county, and that seemed to be holding up the process, and it was a bit of a barrier. Following the floods, we met and realized we had some duplications of efforts, and Kara had this great system that we didn't really need to have two systems, and we merged the system into one, and it's been a lot more efficient. I think tracking is also very more efficient, and it's a lot easier for people to become a volunteer. So I think that also had something to do with the increase. We use anthrax as the worst case scenario because we need to ramp up within 48 hours, and it's really an all hands on deck. We need an awful lot of people that we would run probably 24 hours, like 2 12-hours or 3 8-hour shifts over the period of 2 weeks. So that's our worst case scenario. So if we figure if we have the 348, we could do anthrax, we could probably do just about anything.
Kara, I'm sorry, can you speak a little bit to like, for lack of a better word, but like skill sets and volunteers, or are these just actual people, or do you match them for certain emergencies, or what does that process look like?
So in our new system, we're able to distinguish between our volunteers. So a lot of our MRC volunteers that we brought on originally, we now have in the system, we know who are doctors, who are dentists, who are veterinarians, things like that. We have in the emergency management area, we have like a sheriff reserves, they're always top there. But we're able to get a little more detail now of what our volunteers are capable of. So if we had an example of something with anthrax, I mean, we could reach out to specifically our doctors in our database and tap them first before we would reach out to maybe somebody else that would do, signing people in as they're getting their anthrax shot, something like that.
Are there specific training, the volunteers aren't doing the NIMS training, but is there specialized training around sort of preparing volunteers for?
We've talked about that, and we hope to down the road. Our specialty volunteers, so our sheriff reserves, our SafeCom volunteers, they do receive, if I'm not mistaken, the NIMS training. So we're looking at that as we go down the road. We've got some key volunteers that really helped out in our Jordan flood that I think if they haven't gotten NIMS, they're kind of on the radar that we should get them NIMS certified. So.
And before, all of the MRC volunteers had like a core suggested trainings, and those included the NIMS trainings. And then they also included a volunteer primer for points of dispensing that's free through the through the U of M. And then they could, once in the U of M system, there was a lot of additional trainings that they could. So we did keep track of some trainings, so.
Can we just take a pause for a second? Do we know where the music is?
Soundtrack?
It is not me. I know you think it came with me.
It started when Alexa walked in the room. Kind of calming.
It is kind of calming, but I could see you were all a little distracted, so.
It was me, I guess. Not only was I late, I brought beautiful music.
All right, thank you. Sorry, that's okay. All right. I wonder, just using the Jordan flood and that experience, as long as we're talking about volunteers, if you could just talk about, in hindsight, were there places were there lessons learned through the Jordan flood experience that changed how we might use volunteers going forward?
Take a shot at this one to start it off. I would say absolutely. So prior to the flood, we, with emergency management, had partnered with an organization that made lots of promises about what they could deliver for pet sheltering. We actually exercised them as a part of our full-scale exercise about a year prior to that. Learned that they had a few gaps, but they had a really good group of people, knew how to take care of pets. They were our go-to people. We had worked with them every year over the last decade, confirming that they were available. They actually had equipment that was stored at our regional training center. It was staged there, so we had a very positive relationship with them. When the flood happened, we called them to activate them, as by federal law, anytime that we do any kind of an evacuation of people, we also have to, and sheltering of people, we have to open a mirror pet shelter under the Federal Pets Act. And excuse my phone, it's vibrating like crazy. So we reached out to this organization, tried to activate them in accordance with the activation procedure. We practiced with them, worked with them, and their answer to us was, we just changed our insurance coverage. We can't deploy unless there's a declared state or federally declared disaster. Well, that process, as the board knows, and as those of you who watch the process, that can come weeks after an actual initial event occurs. So their insurance coverage won't allow them to come out here. There's really one organization that does it well. Anoka County has a team that we use as a secondary basis to activate, and they started coming down, but ultimately we use spontaneous volunteers in that situation. So I think the biggest lesson learned from a volunteer standpoint is that this is a gap. We expected to have this nonprofit partner come in and fill this gap. They failed to perform, and as a result, now we have to fill that role ourselves. So this is an area that we're working at, filling the gap and training a group of volunteers to be able to perform that service. So it would be nice to partner with an agency that would do it, but at the end of the day, we're legally obligated to do it. So when another organization failed to do that, it became our problem, in essence.
How about other lessons learned around the use of volunteers in the Jordan flood?
In regards to the volunteers, I think a lesson learned was just kind of I guess the best way to put it is being prepared. I mean, we were able to call out our volunteers right away. That was something with our new system. It's a web-based system, so when I got a call that morning right away, I was able to go to my personal computer, get onto the web, and put out an email request immediately rather than racing into the office having to use my business computer. So that did help a lot. Just little things. We didn't have forms ready. You know, for a pet shelter, we were writing down the animals' names on a piece of paper and who their owner was and who their phone number was. So since then, we've found forms that we can utilize in case of a pet shelter. Just, you know, I think a lot of it was kind of paperwork that we probably needed for FEMA. I can't speak to everything that we needed for FEMA, but just some of those records that we didn't have readily available, what we were able to figure out. So I think we've got Emergency Management now has a couple tubs ready to go in case of that emergency, and that we've got this information. We were literally working off of tablets and, you know, a pen and paper saying, okay, this was our volunteer that came in from such and such a time, and this was, you know, the pet and the pet's name and that sort. So some of those little things, thank goodness they were little things, but that we now know moving forward, should this happen, this is what we need to do.
How about for public health and environmental services in the coordination? Were there lessons learned from Jordan through, because there's a lot of references in the packet to some concern about silos, and I'm just wondering what, in terms of how all of you work together, what went well or what were the lessons learned?
I think from the public health perspective, one thing I mentioned earlier is that duplication of efforts for our volunteer management system. So since that time, we've merged them together. And then some other little things, the communication, how to get a hold of public health on the weekend. A call was made to someone who wasn't a 24/7 employee. So just sharing of those plans. If there is a public health emergency, here's who's 24/7 and here's how to activate public health. And those lines of communication. Anything on the?
For environmental health, I think the communication goes pretty well with Scott and Megan Tasca, the water resources engineer, and then Joe Wida for mobilizing. So we're not directly by the damage of the flood, but leading up to the flood, staying in communication with each other on the water level, when things are going to be, when the flood is going to occur.
Okay.
Were there activities or pieces of that response that you think went really well, like went exactly how you had hoped, that you would want to make sure are sort of in place to be replicated should another event happen?
I think in any kind of a crisis, nothing is perfect. So if I would say that this was a perfect response, I'd be full of myself. However, I think there's a lot of lessons learned as far as what really worked out well. Valley Green Trailer Park, where a lot of the concern is an area that has flooded in the past. It flooded back in 2014 as the most recent event, and as a result, because it was a chronic flooding or chronic area prone to flooding, there was some experience that was residing with the city. So when things did get to the point where that creek level was rising very quickly, the city enacted its plan, which was to activate buses from the school. They already had a pre-established shelter at the high school, and that part worked really well. I got a call from the police chief. I was in our EOC at the time. I'd sent Ron Holbeck, my deputy director, out to the scene to get more situation intel. But I stayed in the EOC and got phone calls as to what was going on and what they needed. One of the elements that hadn't been done in Scott County before that worked out well was issuing a wireless emergency alert. So we were able to send an alert out to cell phones in the area advising them where the shelter was. And that had kind of dual benefits. One, it alerted the people who were impacted, but it also prompted some spontaneous volunteers to show up at the school location with blankets, toys, drinks, food, all the stuff that, you know, good people come out and try and help their neighbors. That totally happened at the high school. So that part, and this is largely to the credit of the city of Jordan. they've been through this, they activated that plan. They looked to us as a way to supplement the resources. So we had our volunteers, what worked out really well and was unplanned is our reserve unit was actually doing training at the Regional Training Center that night. So it was a phone call to our sergeant who was over the reserve unit saying, we need to activate you, and it was a matter of minutes. By the time the first busload arrived at the high school, we had a number of our volunteers already there. We had our temporary sheltering kit where we register people who've been displaced already there, and the sheltering element really worked well. And then the last thing I think that worked well was prior to this, we had been meeting with the American Red Cross over the course of about 2 months' time, and we really pegged that we were very concerned about the Jordan area. So they had looked at that area. They knew that there was a potential that this was going to be a large potential evacuation area or sheltering operation, and they were ready for that phone call. So our role in that kind of a situation is to provide the sheltering. However, in this case, we've got a good partner with the Red Cross that we were able to call them. We provided temporary sheltering for about 5 to 6 hours, at which time the Red Cross had their permanent shelter in place, and we could then move all of those who wish to go on to the permanent shelter, as they call it, a short-term shelter. So that part really worked well. Even from the elements of the high school is located right next to I think it's the CERC, which is the American Red Cross, so people just had to walk from one location to the other. And that part really worked well. From the displaced people, they were very happy with the information they were getting. The police chief was providing daily briefings to them, so they knew, what to expect, what actions we were trying to take to mitigate the problem, and they were being informed. They had the ability to go out and see their pets, and we were providing transportation for that. So that part really worked well. The sheltering operation worked well, and I think experience taught us some lessons from 14 and prior years.
I think one other thing that worked well were the mitigation strategies that emergency management did afterwards. They went around in the trailer park and distributed information and supplies to help clean up water and water damage to prevent any kind of mold. And we got very little calls from that area, so I'm going to assume that those prevention strategies worked. If you look on page 22, we had a lot of precipitation in 2019, and one of those effects of that is we had, from a public health nuisance perspective, is we had 4 times as many mold calls. And we attribute that directly to the amount of precipitation that happened in Scott County. So it could have been a lot worse. So once, even after the flooding went away, a lot of these homes could have had quite a bit of mold, problematic mold in their homes. So I feel that those mitigation strategies that emergency management did were fairly effective, and they distributed them in different languages, so it was helpful.
It's clear how important volunteers are in emergency management. On page 19, there's a graph on the economic impact of these volunteers. And I'm just wondering kind of what the formula looks like to put this graph together. I imagine you're counting the number of hours these volunteers are provided by some type of hourly rate. Is it that FEMA establishes? Or just tell me a little bit more about how these dollar amounts got calculated.
So that dollar amount comes from independent sector, which gives out a nationwide dollar amount per volunteers, and then it also gives out a state amount. So every year that number comes out in April, and that is the number that we used for that. So we just took it, I think it was, I didn't do the exact calculation, it was like $24.18 or something per hour for volunteer services. So that kind of covers the full spectrum, but that's where that number came from.
And that's an amount that's equal, or it's the same for both the medical reserve and the SafeCom? It's kind of across the board?
Correct, it's an across the board.
And I know that SafeCom covers a variety of things. It's mentioned weather spotting, call centers, sandbag, evacuations. In 2019, what was kind of the spike in those hours from the SafeCom group?
A lot of this came down to pet sheltering operation. So we ran a pet shelter for 5 or 6 days, and that's an area that is staffed 24/7. When we take people's pets into our custody and open a shelter, we're responsible for them. So we have to provide staffing 24/7 to make sure that works. So we had a phenomenal group of volunteers. I can't speak enough to the quality of people. People were taking days off work so that they could work, very long shifts to make sure that these people's pets were taken care of. So we had, for a number of days, 24/7 operations of volunteers keeping that pet shelter going. That was a big part of it.
Can we go back to page 5 for a minute? So, so Scott and Lisa, when we were here last in 2018, one of the questions from the commissioners at that time was, gee, 32 capabilities is a lot, can't possibly focus on all these things. So I think there's about 10 red boxes. Certainly we want the green boxes to stay green, but there's about 10 various shades of red boxes. When you look at that as directors of our emergency response teams, what's your recommendation around priority?
Want to start?
I can start. So these are the emergency management ones, and the ones on page 6 are the ones that apply to public health.
Thanks, Lisa.
I think, and I'll let Alexa also respond, related to our upcoming exercise, but I think in my perspective, I think that community's resilience and community preparedness is critical. We have 141,000 people in our county. If something happens during high season where we have Valley Fair and we're a destination county, so we may be responding to 200,000 people or more. I think we have a small number of staff. We have only a limited capability, and we want people to be able to respond to their own emergencies and be able to recover, so we only have to help those that really absolutely need it. So I think increasing that community resiliency, the community capacity to respond to an emergency. If you look at page 3, we had these 10 threats listed, and these don't even include the public health emergencies. Since we met last, every single one of them but one has happened in our area. And now we're in infectious disease, possible coronavirus. We have hepatitis A outbreak. We have flu outbreak still going on still. We have low hospital bed capacity. So we're at a level where we are under normal response. So what happens that's going to tip the scale? If we have a widespread coronavirus outbreak, it's going to be an issue. So we really need to focus a lot of our work on both sides of that coin, our capabilities, but as well as the community's ability to help themselves in a time of a disaster or an emergency. You want to add?
Yeah. So what does that look like? So what would be the priorities to do that, Lisa, to really get out in the community and help prepare them to help themselves?
And what would tell you that happened, right? That the community is in fact now more prepared?
I'll answer the second question first, because we currently don't have a question related to preparedness on the resident survey or any other survey. We're actually measuring that. And what does that mean? Does that mean that they have a to-go kit in their home, or they know what to do during the tornado? We're not really quite sure what that metric is. But Alexa has done quite a bit of work already on community preparedness, if you want to talk about some of your daycare work and faith-based.
Yeah, I think there's so many scenarios when we look at, on page 3, the top threats, and then you add the public health ones in there. There's so much to be prepared for. It's really difficult to find a metric. So I think having an understanding that there needs to be some level of preparedness is kind of the start in understanding what emergency preparedness is and what that looks like. So we reached out to a vulnerable population. We used our child care providers and our foster care providers because we knew the reach of that. So we started with teaching about emergency preparedness to child care providers. DHS had come down and said that they needed an emergency preparedness plan, but not given a lot of direction in coordination to the timeline for this plan. So we offered a class and taught that class to our child care providers. And then the following year, when we were working with licensing, we had done a survey asking them what do they want to know more about. They really wanted to know more about infectious diseases, and so we reached out to them to teach them about infectious diseases, the awareness, the prevention, and the control of them, and then really teaching them about what emergency management's role in public health role is that? So why do you report a disease? Why do we have reportable diseases? Why does public health call you back when you have a pertussis outbreak, and trying to help them connect the dots so they kind of see the full circle. So I think a lot of times we tell people to make a kit, but we don't kind of fill the whole circle, and I think that's what preparedness looks like to me, is having a better understanding of the whole way around.
So you've, I think it's great that you've targeted those areas. What would be additional community groups or folks in the community that you would see targeting next to keep that, to keep training and helping them be more prepared? Do you have some of those ideas?
So my next group that I'd like to see prepared and hope, or kind of target is, I want to kind of build on this so that we don't lose it, so that we don't just train the group and then move them on. So with the child care providers, then we quickly tied in foster care providers, which was at the request of licensing, saying they could use these same things. And we knew that now child care was talking to their families about it, but the families didn't have that education. So now we're looking at targeting those families. And I think targeting not only vulnerable populations, because those are the ones who will need so much help, but populations that can continue to spread our message, so that the message doesn't stop with me, so that when we give the education, they take it one step farther and they share it with those. And that's why child care providers were so important, is we provided them a kit to talk to their kids about it, and then we provided them information to bridge that gap with families, and now giving the families the tools to take it, the next step. So I think there's lots of people we could do that through, educators,
So just to add in a few things as well, some of the areas that we've touched upon are getting out into the faith-based community as well.
Yep.
I know Alexa led I believe it was a 4-part series, or
Yep.
maybe more on preparedness that we were involved in teaching active shooter response. That actually flipped off of one of the participants in that then made a request, and I actually came in and did usher training for one of the churches that was involved, and over the course of 3 different sessions taught their ushers and their greeters things like basic first aid, how to use their resources, proper notification of 911, how that really works, and then going through some scenarios with them as far as what an evacuation of their facility looked like, how to respond to an active shooter, and actually trained at that level. Another area that I think Alexa's worked on as well as us is trying to hit kids. If you train kids, it's remarkable how resilient you build a society. So we've been focusing on teaching scouts. We've had Weeblos, which was really crazy, in the EOC doing first aid. We had some brownies. Some brownies. It was pretty remarkable. The leader got wrapped up like to the point of being a zombie as we were teaching first aid. But when you catch a kid and you teach them about preparedness, you teach them those core lessons about why it's important, they hold that and they grow up with those skill sets. I think it's especially important to hit that group because participation in things like scouting is down across the board. Participation in things like camping and a lot of the more traditionally resilient things. I mean, those, as a society, we're shifting away from that. We don't have people who go camping on a regular basis. And as a result, when we talk about being resilient, as I really talk, if you can go camping for a week, you're ready to go. If you can plan and work to maintain your food, cook your meals, live in a tent, you're in pretty good shape if a disaster hits you. If you've never set foot in a tent, if you've never planned on how you're going to cook your food for a week, you're going to be in trouble. And that's something that we have to kind of shift. As society changes, we have to understand that some of those things that hardened our society in the past is shifting, and we have to be able to address and try and fill in those gaps.
I think with that, when you can teach a child these things and what we talked about in our classes, you can take away some of the fear. So we know these things aren't going to happen. We've seen them happen. But if you can help reduce that fear, the public health person says in me that it's like better for them overall. But reducing that fear makes it easier on the family, makes it easier on the child. It's really what a resilient community is. And so when they hear a fire alarm or they hear a whistle, they know what to do. And when a kid is in routine, they're happy. It's when they're scared that it's difficult. So
Just one quick story on that as well. So I forget the state that this occurred, but there was a boy who learned in school, tornado sirens or outdoor warning sirens go off, you get everyone down in the basement and shelter. He was at home playing on his whatever game machine he was on. Sirens went off, he went to mom, Mom, we gotta go downstairs. The sirens are going off. Mom was like, it's fine. It's blue out, sky looks great, not a problem. Sirens kept going off, Mom, we gotta go downstairs. The sirens are still going off. So mom begrudgingly grabbed her kids, went down in the basement. Within 30 seconds, an F4 tornado went over their house. And they were fine. They walked out and they were fine. Why? Because that kid got taught in school, taught in the community. When sirens go off, you take action. As adults, we've been there, we've done it. You know, we are stupid and run out with our phones to see if we can record it and get on YouTube. Kids get these messages and they grow with them. And that's why it's so important to hit that target audience. We really build resiliency if we build strong kids.
I also think there's a lot more work we need to do with the faith-based community. I think that there is a segment of the population that may not trust the government. So even if we open up a large mass dispensing site, some people aren't going to come because of fear for other reasons. And I think by engaging the faith-based entities especially in a widespread emergency or disaster, there's a lot of fear already, and they may not trust the government, but they do trust their faith-based community. They trust their clergy, and by engaging them in part of the response, it will also alleviate some of the pressure off of us, and we will hopefully attract or serve those populations that may not come to a government-led response.
So getting back to the chart, I absolutely support community resiliency. I think that's an area we're all passionate about, and we see the benefit and see the impact of that. I also see a few other areas that we really need to improve as a county. Cybersecurity is an area that we need to improve on. Our fatalities management services. If we have a mass fatality incident in this state, anywhere in the state, there are very few people who truly understand how to process that scene, how to deal with people. There's the medical examiner and their job in doing the forensics of what happened, but there's also a component of how do you support the victims? How do you support the families of the victims? There are very few people in this state that have that capability. If it happens here, we're going to reach out to partners and try and make that work, but I'm not confident in our capability to be successful in that area. No one in the state has experience doing it, and it's one of those things that's very infrequent but high-risk event. You have to do it correctly, and especially in an area like Scott County where we have River South and we bring in 35,000 people out to the Renaissance Festival in Mystic and Canterbury, the possibility of something bad happening in this area is exceptionally high compared to most of the metro, and we have to be responsible for that. Another area that I think we need to improve, and we're making small steps in, is mass care. We have limited ambulance capacity within this area, and I think that's an area we have to continue to improve our first responder base on. I'm sure you've all seen where there's an accident and it takes a while for the first ambulance to get there. The second one may be 10 minutes behind. If we actually have a mass casualty incident, getting the number of ambulances that we would need to be able to process that scene and get people transported to definitive care it's going to be a challenge, and that means that we have to establish some stability and stabilizing capacity prior to the arrival of the emergency medical services.
So Scott, on both of those, fatality management as well as the mass care services that you talked about, what's it going to take to improve those areas, and what resources are really required, and what are the next steps to make progress in those critical areas that you've identified?
So in mass care, we're actually making some steps on that now. We're partnered with Shakopee, Milwaukee, and Sioux community and our fire departments and police departments, and we've been working through delivering a standardized trauma care curriculum, and that would be passed out to all police and fire countywide. We're also using some grant dollars to acquire some really mass casualty trauma kits that would be used for mass shootings, mass stabbings, those types of situations, and we are going to have those staged in police cars and fire trucks around the county that will be supplementing with this training.
How about on the fatality management, because that's where you kind of really identify that across the state it isn't really occurring very well. So what as a state or as a county even do we need to do to move the dial to be prepared for that?
In the emergency management world, we've been really trying to get a grasp on what this looks like. My personal belief is that we create a set of statewide teams that actually develop this skill set. I know a lot of the county's public healths have tried to work through some of the elements of it, and Hennepin has a pretty good system. But as soon as you get out, especially once you get outstate, there's really nobody who's got that skill set. It's a very limited group. So if we're going to open a FAC,
Family Assistance Center.
Thank you, Alexa. So if we're going to open a family assistance center, understand that we're going to run 2 operational periods a day, so 2 shifts a day, and this is a place where victims come and they work with medical examiner, they work with human services to be able to get resources, they work with DMV, they work with, in some cases, the FBI or victim services. This is where they get the resources from. To be able to organize and run that and to have staff to be able to do it over 2 shifts per day and run that for a period of 7 to 10 days, we just don't have the capacity to do that. We don't have the number of staff to do it ourselves as a county, even if we had all the training time in the world and we could just not do our jobs for 2 weeks. We don't have the people to do that. So that's why I think a regional or statewide team is the right way to go, and that's I think where we've on emergency management been trying to work with some of our partners to see what that really looks like, and then get it funded. More importantly,
Is that a model that other surrounding states have used, or are there other models to draw from?
most states use the Red Cross. So if there's let's say there's a plane crash that occurs, if the NTSB is the authority over whatever the transportation accident is, they have a contract in place with the Red Cross to deliver that service. They are in charge. Where we get into the mix is if it's not a plane, train, or automobile crash that's really big, and the NTSB doesn't come in, and it's not something that's declared an act of terrorism, that's on us. So that's why this is something that people haven't historically put a lot of resources into, because, oh, it's a plane crash, NTSB comes in and they have their contract with the Red Cross and they deal with that. I've actually gone to a couple classes with the Red Cross trying to understand more, but it's still, it's a really big resource to be able to staff that and to be able to provide the resources and keep people trained. I mean, we all have turnover, we all have lives that go on, and keeping a team that's very effective at that and ready to go at a moment's notice it's very challenging.
There are lots of incident management team models within the state that work really well. So there are incident management teams that will come assist you in your EOC. There are DMORT, which has to do with disaster mortality team. So there are models of response teams that are used really well and effectively in the state and across the nation. So,
Do you have any large-scale exercises or tabletop exercises coming up to test some of these gaps?
Want to talk about yours first?
are you sure yours plays right into that? I'll go first and then you can go next. So we do have a very large, what's called a full-scale exercise. So on the scale of exercise, that's the highest level of exercising, which means boots on the ground for all positions. You're not simulating anything. You're acting it out as it was a real event. And so on June 17th, we'll have a mass dispensing site, and that's with our partners at Shepherd of the Lake Church. And we will be dispensing medication in an anthrax scenario. So we will have, our hope is 500 plus volunteers walking through, receiving their medications, and we will have the whole point of dispensing or pod site staffed. And each person starting tomorrow, there's a series of 30 trainings to train about 100 people to staff this pod. It's really important to note that we have put it at our lowest possible dispensing. So when you think, 100 people, right, that's not what we would need in a real emergency. But our hope is to get a better understanding of all the processes and then how it works for the clients that walk through. We're working a lot with our data, our health data planner to collect some really important qualitative data or quantitative data, because we don't get a lot of these opportunities for process improvement. So we need all hands on deck, and we hope that you guys are all there to come and watch, observe, or be part of the day. I can give you a job. Trust me, I've got them. So, yeah,
And then the
Can I ask
following,
a question on that?
of course.
That's a full-scale exercise, so I'm wondering if this on page 10 is a typo under next steps, but the third bullet down, it talks about senior leadership going through the NIMS training, and that there'll be a full-scale exercise scheduled for 2027. That's got it.
that is a typo. I don't know how that happened. So, I wish it was 2027 to give me a lot more planning time. 2021 is correct.
No,
No,
2020.
that's emergency management.
Oh, yours,
So-
sorry.
Yep, so this year, 2020, Alexis got her full-scale exercise. 2021, apparently my wings gang get some wings on them. In 2021, we're doing full-scale exercise and emergency management planning, and that is for an active shooter hostile event scenario occurring at an entertainment venue within Scott County. So with that, we'll be going through and simulating a complex attack type scenario that occurs at one of our entertainment venues, which will test initially the law enforcement perspective of containment and response, but then integrate the fire department's EMS. And really one of the unique things that we're trying to do with this is integrate our private sector partners. So the reason why we're partnering up with one of our entertainment venues is they are our strong partner when something happens. We bring, we bring all these people in and go to these events, and there's EMTs that work at these different amusement parks or Canterbury or Mystic. But in the past, a lot of times, fire comes in and police go in and they go right past those people. They know the local facility. They have the medical training. So we're really focusing on incorporating them within this exercise as well.
Mr. Chair, Scott, that was an important point. Would you hit it again? Involving the privates, is that what you?
Absolutely. So we're really focused on evolving the private sector within our exercise, because they are the first responder in any of these
Thank
events. And I think Alexa alluded to it a little bit. When we have these full-scale exercises, people pay attention to the exercise itself, the hour and a half, the 2 hours of the exercise. But when we follow an exercise plan, what we're looking at is we look at where we have gaps. We identify gaps, and then we identify a training plan to fill those gaps. We implement trainings, just like I talked about, we're implementing the mass care training for police and fire. We've actually incorporated this year, when we had our ICS 300 course that we offered, we had Canterbury Park and Mystic Lake security staff that were in that incident command course with us. So we're really reaching out and trying to do this. So if you look at the hour and a half is exciting, but there's months and years worth of work that go to actually building capacity, so that by the time you get to this full scale, people understand the role that they perform, and they should be able to perform that successfully.
This is really, for us, the cumulative of all of public health emergency preparedness planning money since 9/11. They have said, now you have had this time, now show us what you did with all your planning. And so for us, this is really important. It's not just us, but it's every CHB that receives public health emergency preparedness funding in the state will be operating on that day. So this is a big day for public health and preparedness money. And then we'll kind of close that book and keep those updated, but we'll really shift our focus to highly infectious, contagious diseases after that. But also, I just wanted to touch quickly, as we were talking about family assistance centers, and Jennifer, we hope in the 2021 exercise, public health hopes to exercise a component of our family assistance center, because that falls in our area of service. And so we've worked with Scott. He knows that we want to do that, and we've had those initial conversations and processes of how we might exercise that. And so.
Can I ask, as you think about community resilience and resiliency for individual residents, where does scale fall in that? There was a couple of references in the narrative, but is there a vision for how scale would partner with us as a successful entity?
So Not necessarily from the reaching down to the individual citizens level, but when we look at reaching out to government across the county, that's an area where I'm very interested in trying to integrate into scale. So a good example is, we have disasters. When a disaster happens, everybody gets split up. FEMA will work directly with the townships now and kind of go around us at the county. We got to make sure we keep our nose in it, otherwise they'll actually segregate all the different resource types. And FEMA has this habit of saying, well, it's not really that big, you should probably not apply. So we need to be integrated at that level. One of the things that I have in our emergency management strategic plan is to bring in a series of courses called senior and elected official training. And that's designed to teach people who are in elected roles or senior roles like a city or county administrator what their role is as a policy group when some type of a disaster occurs. So that's a training session that I think I brought to the chair, vice chair meeting about a year ago as something that I want to bring forward. Originally, the thought was bring it forward to the county board. But thinking through it more deeply, it actually makes sense to reach out to scale instead. Because instead of having the county board do it at a county board meeting and inviting the cities, townships, school districts, tribal representatives, if we reach out to scale, we have hopefully a better chance at getting better buy-in and getting a wider audience that'll actually go through that training and understand then how to process through these things.
Okay. Thank you. Can I ask one other question? This was a question that came from one of the commissioners in 2018, and that is, as you look at the mandates and there are many mandates here, are there things that, are there places where elected officials could advocate for you on mandates that maybe aren't adding value or are bureaucratic rather than really contributing to safety?
I think on our level, one of the difficult things is our mandates come from the federal level, and I think it applies to public health as well. So from a lobbying standpoint, we'd have to be able to lobby at the federal level. And I don't know that that's something the county's interested in spending that kind of money for.
There is this, and it's federally and statewide, is when there's an emergency, it often takes a long time to release funds to respond. And so there's been discussion, and Captain Haas or Lisa, you know more than I do, can kind of step in, but there's been discussion at the state level of having a fund that would be there and ready to easily release versus having to respond. So sometimes an example would be in Ebola. There has been criticism about the time it took some of the United States to respond to that, but it was because they had to step through the hoops to get the money released. And so the hope is to have a response fund that could be quickly released versus having to have a declared emergency and then kind of do the steps backwards. So that's one area.
Yeah, and to put things in perspective, in March we had our flooding in Jordan. We are just now getting all of our costs submitted to FEMA. So understand the length of the current process. And it occurs, so the county will do a declaration where we, ultimately the board is saying, go get money or go take some type of action through that emergency declaration. After that, then we're reliant on the state to do a declaration. After that, then once the state declares and says they believe it's to the federal threshold, then the state will make a request to the feds. FEMA will evaluate that, do a preliminary damage assessment, look at the dollars, and then eventually that goes to the desk of the president. And once the president signs it, then we become a federally declared disaster. A month or two after that, FEMA actually will show up in town and start renting space. Once they rent space, then they'll start setting up the meetings where they'll first start going through that cost. So it's very common in the current setup that it's 6 to 9 months before we see a dollar on any kind of a disaster.
Maybe we'll stop at this point and open it for questions from the audience.
So my question is, you talked a lot throughout your delivery of the data, and thank you very much. It was very informative. You also called out a lot of the issues that we have, particularly around the area of staffing. We are a
a conservative county, so we don't staff many things at the level that if an event occurs that we can respond. So with that, do you talk about the training with scale leaders and making sure that our staff knows what their functions are and they're properly trained. But in an event, when you know that you have to coordinate with multiple cities, the tribe, and whoever else, do you have that consolidated plan where when you go into a training, there's a unified approach with all of our public and private partners that we understand and we agree upon roles and responsibilities? Not that you get into training, you teach someone, and then, or you lay out the expectations, and then there's maybe a little bit debate.
So that's a complex question, and I'll try and answer it. So one of the challenges that we experience that makes it difficult to do that cleanly is that we run into jurisdictional lines. Again, referencing the Jordan flood event, the impact was in the city of Jordan, but the ice jam was actually out in Sand Creek Township. Because the township really didn't have a significant impact, they don't have a whole lot of incentive to solve that problem for Jordan. So Jordan ends up having to deal with that problem. When we deal with a disaster or large-scale emergency, as we've said, I think many times in the past, all emergencies start local. So the township has to have an emergency process for the township itself. Then each city has to have a process for the cities themselves, and then they work up through the county. And that's where the county's role really comes into trying to coordinate that. But what that looks like changes in any kind of a situation based on who's actually impacted, and if it's something widespread versus it's contained within a geographic area. So the components of NIMS are to standardize this process. That's why we are pushing out the NIMS training. It focuses on establishing a nationally standardized process for making decisions, for communicating, for understanding authorities and chain of command. That's why we push that out, to try and establish that commonality. However, when it comes down to it, each entity still has their own budget, their own procurement rules, their own political concerns, and those are real, and that's what drives business decisions.
So I had one, back on page 5, and the board has 2 tactics, right? They even put this into their strategies after the last meeting, the priority to take a look at. And I'm assuming, you talked about the resiliency in the community. That was one of the tactics. It was good to hear developing a work plan and a kind of a charter in that area. But one of them you didn't hit on was housing. You said the temporary went well, Scott, but when you highlight that one in red, what is it you're looking there, and what do we need to be focused on and working on?
So this is a challenging area. We know housing in Scott County is not something that we have a whole lot of surplus in. So when we're referring to this in the recovery stage of the capacity, what we're talking about is getting people back out of a shelter into long-term housing again. The fact that we can do a really good job at putting people in a shelter. We can get them, we can staff a shelter, we can keep that open for a couple weeks, but no one wants to live in a shelter. Where we have a gap is trying to figure out how we then take that displaced population and then get them into long-term housing. And that's an area that's a real challenge in Scott County because we have such a tight housing market. Take a scenario in Valley Green, there's about 1,000 residents. If that whole trailer park flooded and we were able to keep them sheltered for some time, where in the county would we find the ability to put 1,000 people into housing? That's why we're struggling with this from a long-term resiliency. If we're talking about recovery, we're talking about getting people back into a home. And with the tight housing market that we have and the expensive housing market that we have in Scott County, that's a real challenge. Especially, I just want to highlight real quickly, a lot of people think FEMA comes and gives them money after a disaster and that gets them back on their feet. I think we need to really understand FEMA's stance is you need to be insured. If your house has damage, the expectation is you go to your homeowner's insurance. If your house was flooded, the expectation is you had flood insurance or you had a backup rider on your homeowner's insurance for septic or sewer failure. The average amount of money that FEMA gives in a declaration So in Houston, a few years ago, when they had literally 5 feet of rain, the average payout from FEMA to individuals was $2,500. So if you think about, you know, you've lost everything because you didn't have flood insurance, $2,500 doesn't pay for your hotel room. I mean, it's not gonna get you back on your feet. But that is only if we actually get to a big enough catastrophic disaster where FEMA actually provides money. Like on our flood in March, that situation wasn't big enough for FEMA to provide any direct assistance. So we're relying on our private sector partners to come in and try and rebuild houses and try and help people. And it's still going on. I know the Red Cross just 2 weeks ago provided 3 different residents of Valley Green another $850 in long-term care to improve their houses. There's still damage to their homes. So this is a gap area, and you know, one of the things we, I think, have to address is what's affordable housing look like in Scott County, and how does that impact us then in a disaster? If people are living in a trailer park or starter home, and they are, you know, living on a pension, or they're living on a tight income, if they're struck with some kind of a disaster, what's moving forward look like for them? And that's quite frankly why we're dark red, and I don't know what the answer is to that. If we had to displace 1,000 people and put them in housing, I don't know how we would ever do that with this county.
Okay, that's a tough thing to transition off of.
Happy notes?
However, I think I will turn it back to you, Mr. Chair, for questions from the commissioners.
Very much appreciate that discussion. Members, any questions that you may have?
Well,
Yeah.
and that not knowing how to do that, I mean, I would think if we had an emergency, people would come forward, and if you painted it in the right way, they'd come forward in advance and say, in an event of an emergency, I've got 2 bedrooms that are vacant all the time. You know, I mean, there's got to be a lot of that kind of capacity in our county, and I would think if we promoted, would you make your home available in the event of an emergency to someone?
And I think short term, I agree. I think there'd be a lot of people who would open their homes to people who are displaced and need help. But if people are already living on the edge, and now they've lost their livelihood, and they've got little to no aid coming in, how do they move out of that then? And I think that we talk about transitions, you know, we real short term have a sheltering. We get people to someplace safe. Then we have more of a shift to a Red Cross shelter where they're going to have a bed and meals for a number of days. But there's a point where we got to get them out. And I think people would be open to, you know, assisting in that capacity. I think we have a lot of really great people in the county, but I don't know where that line is drawn. And I think after a month or two, even the nicest people start saying, okay, it's time to get out.
Since we're on that topic, I just want to jump in. So what do, it's the 1,000 residents, right? That's the number we're talking about. What do other counties do that look like us and that are near larger counties like, I mean, this is the first time we've had an issue, or a county like this has had an issue, or potential issue. What are they doing, whoever the they is? Do we know who the they is? What does that look like? Is it just temporary shelters in high schools with Red Cross, or is it something more, or what?
So I think a recent example that we can all reference is the fire at the Drake in Minneapolis. And in that situation, it kind of followed the same pattern of sheltering. People stayed in a Red Cross shelter for a number of weeks, and then Health and Human Services came in and tried to get those people into longer-term care. And some of that was, it was really a mix of locations. Some people went into the short-stay hotels. Some people went into other assisted living environments where there was some assistance to get in there. But even that, I mean, I don't know if you recall the numbers from how many were displaced.
It was less than 30 families.
Right.
So, I mean,
But that was
on
a
small
significant
scale,
effort.
It's a huge effort.
Significant effort to find 30 families. If we were talking a larger event than that, I mean, if we were really talking about 1,000 people, the county may be buying land, and we may be ultimately looking for FEMA trailers. and setting up a trailer park somewhere. And that, again, it's all dependent on the situation, but that may be something that we do, that part of our declaration is we're gonna have to find a willing or unwilling landowner, and we're gonna have to create infrastructure, because we just don't have a number of houses that we could acquire and put people into, especially if they don't have the economic means to sustain that. I mean, just paying the taxes on a starter home, if you don't have any money, is not possible.
So, I mean, that would probably be the solution, because is there any county that sits back and says, oh, we got 1,000, we can warehouse, so to speak, 1,000 people at any given time, if something happens, if fire hail drops from the sky, boom, we can get them in. Nobody does that.
I don't believe so. I don't think anyone's just sitting on that kind of housing capacity. The market's just too tight here.
Right. Right, exactly. So I just wanted to jump on that.
Even the RTF would probably only hold about 100 people, not even.
Can't put people there. Sorry.
In an emergency, we might have to.
Am I good to go, Mr. Chair?
You are good
All right.
to go.
I was waiting for the oral comment.
Great to go.
Scott, just a stray thought that occurred to me. I'm thinking of my experience in North Dakota with the man camps up there. I wonder if part of our emergency planning for 500 people would be just to identify sites where we could lay sewer and water within 5 days or something to sustain an influx of FEMA trailers. Because it's not just putting the trailers there, you got to hook them up. And even if it's a temporary deal, we'll probably have to deal with building inspectors and all that stuff. But in an emergency situation, you would think that just having a site somewhere that you wouldn't even have to buy it, even if you worked with a willing landowner to put an option on it or something in the ungodly event that something really severe happens, we're going to do this. That's the plan. Just a thought that you might want to consider.
So this is, I talked earlier about the policy group and getting the elected official training brought forward, and this is exactly the kind of scenario why we want to bring this training forward. Because ultimately you as the policy or the county have to decide what is the threshold. I mean, you're opening the door to what we're going to be willing to buy. You know, just think it through a hypothetical situation. Would we take one of our parks that has sewer and water and be willing to shut that down as a park to provide temporary housing?
Sure.
It's a possibility. Some of them have sewer and water. It would be a possibility. The county already owns at least a component of many of the parks. If we had to go through a process of actually acquiring land and then running sewer and water to land, it's going to take time. It's going to take a long time.
Well, that's why I'm thinking, Mr. Chair, identifying sites where it's possible or less complicated might be a good thing. Might not be right adjacent to where a tornado hit or a flood happened. It might be several miles away. It might be in another county. So I would encourage you to consider our cousins over in Carver County. They're thinking these same things, and just because we have to cross the river, which brings me, the cousin comment brings me to my last thought, families. The family is the basic organizing unit of society, and there's a reason for that over the centuries that's developed. Because when things happen, oftentimes our first line of defense is mom and dad, aunts and uncles, brothers and sisters. And I'm thinking of my family scattered throughout this county, that when things happen, the first thing they do is pick up the phone, call mom and dad. Can we borrow a couple bedrooms for a couple months or something like that? And I'm sure that happens to a lot of folks. A lot of that immediate urgency when we have to get them out of a home and into a temporary shelter like a church or a gymnasium, a lot of those folks get absorbed back into the family structure. And that's something we ought to encourage, I would think.
And that's exactly what happened in the Jordan event. The first night, the attendance at the shelter was somewhere around 90 people in our temporary shelter. And by the time we got to night 3, there was about 13 people that were staying over. Living in a shelter is not a nice thing. It's not something you want to be in. It's uncomfortable. You're away from those things that are yours. It's really a humbling experience. People don't want to be in a shelter, and we've seen that, and I think that's common across the board. People will reach out and use whatever resources they can when that situation happens. What we have to worry about is, what about the people who don't have that close family tie, don't have the capacity to reach out, because they're going to call. and they're gonna look for a solution. That's where we have to make those tough decisions.
And I think that goes back to Leslie's comment about your community resiliency. Resiliency is really returning to a new normalcy and having the ability to pick themselves up. And living in a temporary housing situation does not lend itself to resiliency. And so we really need to be thinking that forward and thinking about, there's a lot of long-term effects. There's not a lot of studies on recovery, but what there has been, especially coming out of Katrina, the long-term living in the FEMA shelters and what that does to your citizens and things like that is really important, I think, to think even the next step longer term.
Well, it's admirable, Mr. Chair, that we want to save their lives immediately and their pets. Thanks for thinking of that. But I'd encourage you to think about Benjamin Franklin's comment about help them, but don't make them too comfortable, or you start to impinge on that natural survival mode that needs to happen in people to improve their own lot or recover. Bad things happen. I'm glad to hear too, and this is my closing thought, that you're thinking and bringing into the discussion the private disaster recovery plans, because I know every factory in this town has a disaster plan in place, and employees know where to go and what to do when something happens at the glass plant at RAR. I know the railroads are famous for having people who are on site in a matter of hours picking pieces up. We ran into that in Blakely here a couple years ago, and so thank you for bringing them into the mix too, and making sure that we don't end up tramping on each other's toes while we're doing the Lord's work here. Thanks.
Mr. Chair, just more or less a comment. I think it's been great to hear the development and the thoughts over the last 2 years since you presented, and good for us to be better educated. The things that really stuck out to me, and probably through our scale, our Jordan flood example too, is the other entities and that jurisdictional work. So I mean, I really applaud the county and the city of Jordan, because that did go smoothly. But that could have, as I was watching that unfold, just egos or jurisdictional issues could have occurred, and that could have been a disaster in itself. So I really encourage us, and it's helped me broaden my thinking, that in some ways it doesn't matter how good our Scott County emergency management plan is, because every single thing that happens in Scott County is going to involve other jurisdictions. That it really has to be cooperative, and so I reading about that, and even some of the challenges with getting things like mutual aid agreements, so that we would be eligible for funding instead of just sharing equipment like we do on a regular basis. I really see that as kind of has to be one of the key things on our mind as we move this forward. And thanks for thinking about that. I know we're out of time, but additional comments on that and thoughts over the next couple of years, how we progress on that front, will be welcome in the future.
Any other questions or comments? Yeah, I just want to dovetail on that mutual aid. That was interesting, because on any kind of sizable impact, that it's not just a truck or a grader. It's for weeks, and so yeah, I would really encourage that as well. Do we need to look at having those mutual aids in place for such a time as hopefully this doesn't happen, but it will. Things happen.
Well, even in the Jordan example, the county used Prior Lakes Vector.
Oh, yeah.
FEMA will reimburse that at $85 an hour. But because of our handshake and supportive network, there was no reimbursement that we were eligible for.
Right.
So, because Prior Lake can't work in the county, because it's without mutual aid request. So it's real money that we are leaving on the table.
Well, and that's in my mind, when I think of scale, I think of that Prior Lake truck on County Road 69 in the city of Shakopee, alleviating underneath that, I think it was underneath the trestle.
Yep.
That is how it's supposed to be. And I pay federal taxes, so it'd be great to get some of that back home. So yeah, whatever we need to look at that for different jurisdictions, and egos do play a part of that, but everyone wants to be reimbursed. I had one last question on silos. Kind of talked about some of the internal silos just with the Everbridge Code Red thing. I get that, the silo, human nature, but when the rubber meets the road, do the silos tend to flatten when the alarm bell goes off and something happened and we need to respond? generally, or is it still, tricky question, but does it flatten out? Do the holes get punched in so you can kind of see side to side, or is it still a very sticky wicket?
I think the answer to that is it depends. In public safety, I think there's a lot of flattening out where people are pretty good at working with each other. But as we look through other organizational elements, I don't know that that is very good. I mean, Kevin Nelson is in the back of the room. He's in a quasi-preparedness kind of role along with Rhonda, and here's Alexa and Lisa, and I'm here. So if you look at just our county, the point of that is that if you look at Kevin and Rhonda, they work in this building under employee relations. Alexa and Lisa work in MRTS under public health, and then I work under the sheriff. So if you look at just that same, if we're really at a high level and we think about what's good for the county long term, it probably doesn't put us all in separate buildings, because that alone is a thing that's difficult to defeat. So what that looks like, I don't know, but that's why I think over the next 5 years we have to have a conversation. What does that look like? What should it look like? You know, I'm here because my deputy director is out of state on vacation, and I'm actually sitting here with a cold. Sorry, Alexa.
Probably gave it to you.
But probably, but I mean, calling in this morning wasn't viable because it's me to represent our. So if we were to think holistically and really have what's the right solution, if we had those resources all working towards a common good in the same organization, whatever that looks like, it just seems to me like that's a better solution for where we are, say, 5 years from now, instead of being siloed in different buildings.
So if I can just touch on that really quick. Personally, in my role, I have never, when rubber meets the road, not had someone come in, but the need for catch-up slows the response. And it can make it really difficult, even just understanding response in general. So to have, someone step in that might not know incident command and try to integrate them because we need them, but they don't have that understanding is really difficult and can kind of impede your response. I think we're doing a really good job with coronavirus. We were all working a little separately, and then we all said, whoa, stop. Mm-hmm. And I sent an email last week, and we established a couple triggers and some thresholds, and we had a conversation, and so we're having a talk together. But right away, I forgot Rhonda, and Cheryl said, include Rhonda, and so it's a work in progress, but if we don't do it beforehand, it's really hard in the response level.
It seems like we as a county do, maybe it's because of our size, whatever, still a fairly open line of communication amongst the different groups and departments, which is huge, even when we're scattered in different buildings. But I applaud the effort of always having those open lines of discussion. We're always open to having those discussions. And it seems like maybe we are getting better because we're experienced in all these weather-related events that seem to keep happening. But this is some great food for thought. Is there any last comments before we close this section down? Thank you guys very much.
Thank you very much.
Appreciate it. Are we gonna take a slate?